prevalence, cancer, like global preference, the people with diabetes have a higher risk of various cancers, particularly colorectal, liver and pancreatic cancer. So cancer is now the leading cause of death in people with diabetes in certain countries. Next is the cognitive disorders and dementia. Up to 20 to 30% of individuals with diabetes are at increased risk for cognitive decline and dementia, with diabetes doubling the risk of Alzheimer's disease. Next is the affective disorders like depression and anxiety. So depression affects approximately 25 to 30% of people with diabetes, and the risk of anxiety is also elevated, contributing to poorer diabetes management. Most important is the sleep disturbance, which accounts up to 30% of the individuals with diabetes, such as sleep apnea, insomnia and poor sleep quality. In our country, the socio-economic impact of diabetes plays an important role. First one is the access to health care, cost of care, poor glycemic control. Next is the reduced productivity, disability and unemployment, educational attainment. Social concerns like social isolation and increased mortality. Next is the addressing the socio-economic disparities. You can see in the bottom, that is the targeted interventions, improving access to health care and promoting healthy lifestyle. So we know the screening of diabetes has to be done in any age group. If the patient walks in, one of the things has to be kept in mind, like as you check for the pulse, blood pressure, temperature, body weight, oxygen saturation, the glucose has to be done in a routine day-to-day practice, so that we come to know what is the basic things. Then the further assessments can be done as per the protocol. The most important preventive strategies is like weight management. If I aim for 5 to 7% weight loss, following a reduced calorie diet, physical activity of 30 minutes per day, that is 5 days per week. Start with low impact exercise, increase intensity gradually. Eating healthy is very important. Portion control and calorie reduction. Choose low fat, high fiber foods. Replace sweetened beverages with water. So key lifestyle, plan healthy meals and snacks. Engage in a regular physical activity. Get enough sleep. Quit smoking and tobacco. Benefits of healthy living, you all know that it controls the blood sugar, pressure and cholesterol, prevents or delays diabetes related complication. To summarize my talk, ladies and gentlemen, the rising prevalence, the number of diabetes cases is rapidly increasing, with projections reaching 783 million by 2045. Serious health complications leads to heart disease, stroke, kidney failure, blindness and amputation, significantly reducing quality of life. High mortality rate that is responsible for 3.2 million deaths annually, with 50 to 80% of diabetes deaths due to cardiovascular disease. Economic burden causes enormous healthcare costs due to long-term treatment, hospitalization and loss of productivity. Preventable yet under control. Lifestyle changes, early screening, proper management can reduce the risk, but awareness and implementation is the key, which has to be done in every day-to-day clinical practice. Thank you for your patience hearing.